And we have a special guest with us today. We're talking to Dr. Mark Hiatt, Director of the Neonatal Intensive Care Unit at the Children's Hospital at St. Peter's Hospital about the neonatal care technologies. And first of all, Doctor, thanks so much for coming on the show right here.
It's my pleasure, CJ. Thank you for inviting me.
And, you know, one of the things when you get to a neonatal and get into the NICU, you see all the equipment. What are some of the new technologies that are in your hospital?
The technology that's involved in taking care of these small and frail infants can be overwhelming. One infant may need over $100,000 worth of equipment just for his routine monitoring. So we need a lot of redundant monitoring of the babies, all the baby's vital signs, their breathing, their heart rate, their oxygen saturation, their electrocardiogram.
And this is like an overwhelming thing for a parent to see a child like this.
It's stunning for a parent to come in and to have a baby that they didn't have it, that's smaller and more sicker than they expected, and to see all of this stuff and all the dozens of people that are involved in taking care of their child. And we often remark that when the parents come in the first time to see their babies, they don't see the baby. All they see is the equipment. It takes them one or two visits, the second visit before they can see the baby. And then after that, they only see the baby and they see less of the equipment.
You know, one of the things we have for our viewers, we have a full screen graphic, and it has some of the ideas that are on it. A vital sign monitor, temperature support for the infant, device to aid and support breathing, warmers and scales, the NICU cameras. And you know what it gets me when I'm in the NICU, I've been there a few times, just like the vital sign monitor, you see everything moving and stuff, and as a parent it's like, whoa, that's very overwhelming. But as a doctor, what would you say to the parent, so hey, everything's going to be okay?
Well, one of the things we have to do is, and especially parents who have a IT background or an engineering background, is they will focus on those monitors and read them like not taking their eyes off for a second. We have to tell them our job is to look at the monitors. That's what we do. You look at your child, because there is, like any piece of equipment, there are artifacts, there's stuff. If you don't know that, it's going to be very scary. With babies, because the information that we can get out of their physical exam and their examination is limited, and the signs of illness are often covert, we have an inordinate dependence on all of this monitoring, this data and information. And neonatal medicine has always been at the ahead of the curve, because we can't ask our patients, do you feel cold?
Right,
do
you have to anticipate.
Yeah, we have to use all of this monitoring to develop an idea of how our patient is feeling. So we really couldn't function without all of this.
So you need all that equipment, and the best part and the best advice I think we give the parents is leave the doctoring to the doctor, the expert, and you just take care of your child. Well, doctor, thanks so much for coming in. We'll have much more with Dr. Hiatt coming up.
Thank you.